Now I'm going to palpate the hand. I'm going to palpate the distal radius and the ulna. Then for the radial styloid bones and the anatomical snuff box and the 8 carpal bones, which is here, 8 carpal bones. And then okay, now for the 5 metacarpal bones. Then I'm going to check for the phalanges, which is distal, then the middle and the proximal. Okay, now I'm going to compress the metacarpophalangeal. I'm going to compress it to check for any swelling or tenderness of the fingers, the thumb. Okay, now I'm going to perform a hand grip test. Now can you please grab my second and third finger? Okay, this is the test for the grip strength. Thank you. Now I'm going to perform a thumb movement. So can you please grab your thumb against your palm? Okay, and then move it downside like this. Okay, this is the ulnar deviation, and it is to check your thumb functioning. Okay. Now I'm going to perform a carpal tunnel syndrome. So while I press down your thumb, can you raise your thumb above it? Okay. This is a test for thumb adduction. Now I'm going to perform a Tinel test sign. This is to check for irritations on the nerve. I'm going to tap it lightly on the median nerve. Do you feel any irritation? Okay, thank you. Like, put both your palm, like, put the back of your hands together, at least for 60 seconds. This way. Okay, thank you. This is the test balance sign. Do you feel any numbness or tingling in the median nerves here? No. Okay, thank you. Palpitations of the knee. I'm going to palpate on the 7 structures of the knee. I'm going to check for swelling around the medial side here, then on the superior aspects of the patella, then on here on the lateral side, then on the knee joint line. The inferior pole of the patella lies on the tibiofemoral joint line, which is here. Now I'm going to check for patella and the patella tendons. I'm going to gently slide the patella here, which is here. I'm going to slide it, gently sliding the patella from medial to the lateral side. Like if there is excessive movements of the patella, it indicates patellar dislocations. Now I'm going to test a patella tendon just below the patella. I'm going to press it. I'm going to move downwards, and here this prominent one is a tubule down the patellar tendons. As you go down, you see a tibial tuberosity, which is the prominent central point. Pain here in the patellar tendons suggests patellar tendonitis. Now making the person sit in a 90-degree position, in a flex position. Now I'm going to palpate again the patella. This is the patella. Then for the tendons, the medial side, the lateral side for any swelling. So here from this is the patella tendons. Like now moving, palpating medially at the medial apex here, medial apex of the joint line. I'm going to palpate the medial meniscus, which is the medial meniscus from here on the medial side, medial meniscus from the anterior. As you can see here, it is the anterior horn. Now I'm going to palpate on the lateral side from the joint line. I'm going to palpate laterally, palpating the lateral meniscus from the anterior horn. Okay, now I'm going to palpate for the medial collateral ligament. From the medial femoral epicondyle, I'm going to palpate it downwards where its attachment is at the medial condyle of the tibia here, and then the proximal shaft of the tibia, and again on the other side, which is this is the medial side. On the lateral side, again I'm going to look for palpating for the lateral femoral epicondyle. I'm going to palpate it downwards, and as you can see here, it is the head of the tibia, where its attachment is at the head of the tibia. Okay, now I'm going to palpate for the suprapatellar pouch, which is like 10 centimeter above the superior patella, is above here. Then I'm going to palpate for the anserine bursa, which is in the posteromedial side of the knee between, which is on the posteromedial side of the knee between the MCL and the medial tibia. Then I'm going to palpate for the prepatellar bursa here. Okay. Now I'm going to palpate for on the posterior surface for the popliteal fossa. Now I'm going to perform a Bult sign, which is a knee joint effusion, minor knee joint effusion. So with the knee extended, I'm going to place my left hand above the knee and apply pressure on the suprapatellar pouch and see if there is a fluid inside it, and then in case if there is a fluid, I'm going to push down the fluid on the medial apex. I'm going to apply pressure here, then I'm going to apply pressure here to force fluids to the lateral side, and with my middle finger I'm going to tap it to see if there is any fluid on it. This is the Bult sign to check for the effusions. As you can see, in this case there is no fluid present in it. Okay. Now I'm going to perform the patella tap test. Now I'm going to push the patella against the femur. I'm going to compress the suprapatellar pouch. Then at the apex of the patella, I'm going to push it upwards, and with a downwards pressure, I'm going to tap on the patella to see if there is any floating, to see if there is a flotations of the patella. As you can see, in this case, there is no flotation of the patella, and therefore it indicates there is no swelling in it. Now I'm going to perform a McMurray test. This is to check for the meniscus damage. Now in a flex position, I'm going to keep her in a flex position. I'm going to externally rotate the tibia with my left hand, giving pressure on the femorus. Now I'm going to externally rotate the tibia, as you can see. Again, I'm going to internally rotate the tibia. External rotation. And keep it down here. Okay. Now I'm going to perform a valgus stress test with flexor 30 degree and to check for the medial collateral ligament injury. I'm going to put my finger here. I'm going to, that's it. Okay, this is to check for the medial collateral ligament injury. I'm going to perform a varus stress test. This is to check for the lateral collateral ligament damage. So I'm going to put one hand against the medial surface of the knee and the other around the lateral angle, and I'm going to push laterally against the knee and pull it medially along the angle. See? Okay. Now I'm going to perform an anterior drawer test. It is to check for the anterior cruciate ligament. So palpate with your thumb on the joint line. Sit gently on the patient's, I'm going to sit gently on the patient's legs, and then pull anteriorly the tibia. Now I'm going to perform a posterior drawer sign, this is to check for the posterior cruciate ligament test. With my thumb palpating the joint line, I'm going to push it backwards posteriorly. If this goes beyond greater than 6 ml, then this test positive for a posterior cruciate ligament injury. Now I'm going to perform a Latchman test. This is to check for the anterior cruciate ligament tear. So the person flex in a flexion position with 15-degree and external rotation. I'm going to grab the distal femur on the lateral side of one hand and on the proximal tibia on the medial side with another hand. Now I'm going to do shoulder examination, first inspecting if there is any assimilarities, and then I'm going to do palpation from the sternoclavicular joint here and moving laterally in the clavicle. Then here, this is the acromion, as you can see, acromion, and here the coracoid process, and here the greater tubercle. Shoulder girdle range of movement. I'm going to show you flexion, extension, abduction, abduction, internal rotation, external rotation, start. Now I'm going to perform a cross body abduction test. This is to test for the acromioclavicular joint. Can you please present here? Is there a pain here? If there is a pain in this, then they test for the positive. There is positive for acromioclavicular symptoms. Drop down slowly. Cut up. 90 degree. Okay. Face downward. Now we'll seize it. Okay.